I have one patient. I'm going to consider my additional resources, and now I'm going to take manual C-spine. At this time, I'm now going to turn my C-spine over to my professional partner.
Duly noted.
Sir, can you hear me?
Patient does not respond.
Sir, can you hear me?
Patient does not respond.
Okay, my impression of this patient is poor because they are unresponsive and the mechanism of injury. I have a high priority patient. At this time, I'm now going to look for my initial life threats. I'm going to open up my airway with a modified jaw thrust and turn it over to my professional partner.
Duly noted.
I'm now going to properly size and insert an OPA. Does my patient accept?
It is accepted.
What is my patient's respiration rate and quality?
20 shallow.
Okay, at this time, I'm now going to bag my patient on a BVM with high flow oxygen. I'm now going to completely expose the chest. Do I have any injuries to the chest to affect my respirations?
Yes.
Okay.
Top left.
On the left side of the patient?
Yes.
What type of wound do I have? Is it a contusion or is it a puncture type wound?
Punctual.
Is it a sucking chest wound?
No.
But it is a puncture wound.
Yes.
Do I have a flailed chest?
No.
So noted. At this time, do I have any other injuries on my chest?
No.
Okay. This time, what is my patient's pulse, radial and carotid?
120 strong.
Okay. At this time, I'm now going to, what skin color, temperature, and condition?
Your patient is hot, dry, and has no obvious deformities.
Okay, I'm now going to do a gross blood sweep.
Your right arm has blood.
Okay, right here.
Yes.
Is it an arterial bleed?
No.
Okay, is it a venous or capillary bleed?
Venous.
Okay, is it profusely bleeding?
Yes.
Okay, at this time I'm now going to apply direct pressure and dressing. Is it controlled?
No.
Okay, I'm now going to apply more dressing and direct pressure. Is it controlled?
Yes.
Okay, moving on. Still doing gross blood sweep.
Find blood on your left hand.
Okay, is it an arterial bleed?
Yes.
Okay, at this time I'm now going to apply direct pressure. Does it control the bleeding?
No, it does not.
Okay, at this time I'm going to apply more dressing and pressure. Is it controlled?
No, it is not.
Okay, at this time I'm now going to apply a tourniquet. Is the bleeding controlled?
Yes.
Okay, continuing with my gross blood sweep. Okay, no signs and symptoms of shock. I have a high priority patient. Because of their unresponsiveness, I'm now going to do a rapid trauma assessment, looking for additional life threats. Do I have any tracheal deviation or JVD?
No.
Okay, this time I'm also now going to apply a C-collar. Looking for additional life threats. Palpating the abdomen, all four quadrants. Any injuries?
No.
Okay, checking for injuries in the pelvis.
You feel crepitus in your right hand.
Okay, I'm now going to secure my hip with a sheet draw method. My hip is now secured. Additional life threats. Okay, that concludes my rapid trauma assessment. At this time, I'm now going to get my vital signs and, nope. On my headman's count, 1, 2, 3. Any additional life threats?
No.
Any puncture wounds or anything, entrance, exit wounds in the back, buttocks?
No.
Okay, at this time, I'm now going to take my long spine board, place it under my patient on my headman's count, log roll onto a spine board. 1, 2, 3. Now I'm going to secure my patient, nipple, navel, knees, head last. My professional partner can now release C-spine. They're secured to the board. Does anybody know anything about this patient?
No.
Okay, I'm now going to get my baseline set of vitals. What are my vital signs?
At this time, your patient has a pulse of 132. His skin is turning cool and clammy. Pupils are unreactive at this time.
Okay, respirations.
28 shallow.
Okay, my patient is going into shock, so I have high flow oxygen already on my patient. They're on the spine board. I'm going to slightly elevate the spine board and keep my patient warm. At this time, I'm now going to load my patient. En route, I'm now going to do a detailed physical exam, looking for decap BTLS. Palpating the head, examining the eyes. What are my pupils?
Unreactive.
So noted. Possible head injury. Looking for spinal fluid in the nose and the ears.
You find
Any?
fluid coming from the left ear.
So noted. Possible head injury. Looking for obstructions in the mouth.
None.
The jaw. I've already checked my neck for injuries. Palpating the abdomen. I've already secured my hips. Doing my 3-point checks
You find crepitus in the left shin.
in the left shin. Okay, I'm going to splint this leg. Secondary wounds taken care of. Do I have a pulse?
Yes, you do.
Can they move their toes?
Patient is unresponsive.
Can they feel me touching their feet?
Patient is unresponsive.
Do I have a pulse?
Yes.
Can they feel me touching them?
Patient is unresponsive.
Can they wiggle their toes?
Patient is unresponsive.
3-point check. 3-point check. 3-point check.
You find a broken thumb on the right hand.
Okay, I'm going to splint it to the finger next. Move on. Pulse.
Present.
Motor, can they feel me doing this?
Your
Can they
patient-
wiggle their
no.
fingers?
Your patient is moaning.
My patient is now moaning.
Yes.
Okay, so I now have improvement to my patient. Can they respond to my commands?
No.
Okay. Do I have a pulse?
Yes.
Can they wiggle their fingers?
Tissue moans.
Can they feel me touching them and respond to me wiggling their fingers and touching them?
They continue to moan.
Okay. At this time, I have now treated any secondary wounds. I'm now going to, I forgot something. I'm now going to do my ongoing assessment. I'm going to go back and retreat my initial assessment of airway, breathing, circulation. I'm going to reassess my any interventions that I've done, treat any secondary wounds, reassess my vital signs, and I'm done with this station. What did I forget?
Priapism.
Priapism, which is not a major fail, but
You forgot to say.
Auscultative.
forgot to auscultate the lungs.
Is that a major fail?